Welcome to Change Starts Here, brought to you by You Are Empowered. I'm Dr. Laverne.
I'm Dr. Marshadi, bringing you real people with real life stories in real time.
We invite you to make history with us on the inaugural episode of our first podcast.
As practicing psychiatrists, we were saddened by the stigma faced by our patients in their everyday lives. Psychiatry Empowered was established in 2009 and initiated various programs to educate, inspire, and entertain a broad range of audiences in order to destigmatize and demystify mental health.
In the spirit of edutainment, Psychiatry Empowered morphed into You Are Empowered to reach a broader audience and become a more inclusive organization.
Our secret ingredients are passion, empathy, curiosity, and creativity.
As seasoned psychiatrists, we use this platform to engage with individuals about their mental health journeys.
We're privileged to have our guests share their life journeys with us, their highs, their lows, their sorrows and challenges.
Today's episode focuses on the often overlooked topic that doctors are human too. Behind the scrubs and stethoscopes, there are people with emotions, challenges, and vulnerabilities. We welcome Dr. Chanel Mini in our kitchen. Thank you for being brave and kind to share your experiences. You're most welcome.
Thank you for having me.
The reason why we invited you to our kitchen today is really because we think the kitchen is the heart of a home, the place where conversations happen, and also where we could have a lovely warm cup of tea. Today it's a chai. We experimented a little with the mixture of spices, and I know we like to keep things seasoned and well spiced and seasoned in this kitchen. So it's a combination of black peppers, a bit of star anise, crushed cardamom, and what have I forgotten? Cloves, which I also cooked over time, let it concentrate, and added my favorite macadamia nut milk, vanilla flavored. And this chai is a little different because we put in some South African spice. It's a rooibos with black chai tea. So I hope you enjoy it.
That sounds lovely, thank you.
I'm curious though, a little bit about you. Tell us what you do, where you come from.
So I'm currently 26 years old. I reside in Linden, Johannesburg, and I'm currently a second year medical intern at one of the facilities in Johannesburg. I am an eldest daughter in a very proud family, which I'm grateful for. And I love my 2 cats and my orchids.
Oh, lovely. 2 cats. What are they?
Both domestic short hairs, both rescues.
Right.
Yeah.
So Chanel, when you and I met, it was a challenging time in your life. Do you want to share a little bit for us about that?
The first time you and I met, I was in my second year of medical school, and I had just realized that I was struggling with my mental health, and I really needed someone to guide me on this journey of what mental health is and what I need to do to get myself in a better space. I had already been on my mental health journey with another psychiatrist, which unfortunately did not end very well. I stopped my meds. I was told to decide my own treatment plan, and I really needed someone to get me back on the proper path, to get me back into taking care of my mental health. And yeah, when you and I met each other, I was in a very dark space. And it was difficult because as mental health care users, we are often looked down on. People don't really talk about mental health, and we don't always necessarily get the support we need.
I'd like to take you back to the beginning when you realized that you had a problem. How did you recognize it? What was the history of that?
When I turned 18 years old, I had a very emotionally labile experience. I used to cry a lot. I used to never be happy. I used to always constantly think that there was something wrong with me. I was permanently sad and I would cry for no reason at all. I then graduated high school, top 10, everything was great. I went to medical school, made it through first year, but realized that I was still sad. I was sleeping all the time. Even though I had so much to be grateful for, my mood was still technically in the gutter. Then in second year, which was 2019, the night before our first anatomy test, I had a very, very bad panic attack because I hadn't studied the way I should have been studying, because I slept all the time and I was not in the right mindset for me to be able to continue with my studies properly. And that was the first time that our house doctor at the time told me that, listen, you might be dealing with depression and you might be dealing with anxiety, and I'd like for you to go see a psychiatrist, which is what I then did in my hometown. And I followed up with that psychiatrist for about 1.5 years, until it eventually went south. And then the wonderful psychologist I was with mentioned that I should broaden my horizons to not only include my hometown, and recommended Dr. Mountney, which to this day I'm still very grateful for.
I understand.
Chanel, you were in your first year then when you realized that there was something that was not all well with you. Do you think as a medical student and knowing something about medicine, it helped you recognize some of your symptoms?
Yes, definitely. At the university I studied at, which is Sefako Makgatho Health Sciences, they focused a lot on the mental health of students as well as the mental health of doctors, which they really helped and empowered us there to realize that what you might be dealing with, and also to give you the support that you needed. Unfortunately, due to the fact that there's only one small department that needs to deal with an entire campus, accessing those health resources and those psychological resources were quite difficult, which then led me to go seek it in private.
I'm so happy to hear that the faculty, at least the university, is doing something around supporting students. So in that moment, you didn't feel necessarily stigmatized as a medical student?
Stigma, unfortunately, will always be there. A lot of people, when it comes to mental health, even when we are medical practitioners, will still use the word crazy. They will still use a lot of derogatory terms, even though we are technically trained to be better than that, to not use such derogatory terms towards our colleagues, towards our patients. So the stigma is definitely still there, and seeking help, even though it was readily available, you still wouldn't go about advertising that, listen, I'm seeing the psychologist, I'm seeing the psychiatrist, because other people would be like, ooh, you need help, really? Which is a very sad situation that I still see on a day-to-day basis.
Chanel, has there been a situation where you personally have felt the impact of stigma?
During my time as a medical student, there were definitely quite a few instances where the stigma surrounding mental health was very visible, not only from departments within the faculty, but also from colleagues. One specific instance was when I was going towards the end of my medical school studies, and where I had a situation where I needed to write 2 exams in 1 week, and where I told both departments that I would not be able to do that, and they told me that they just didn't care, which then led to me needing to be admitted into a psychiatric facility for trying to take my own life, which is something that happened because there was no support for my mental health, there was no understanding, and there was no compromise to try and assist me to finish my studies without making me write 2 exams for 2 departments in 2 weeks, which was kind of the pinnacle of my mental health journey, because then I realized that if I don't take my own mental health seriously, no one else is going to. And the other thing was that the stigma was that mental health isn't really an illness, and if you need a mental health day, sorry, but you're absent.
Yeah, I hear you.
What a difficult experience, and I'm sorry that they weren't able to support you in that way, the university. But I think it speaks about our profession. It says something about who we are, and how oftentimes we ourselves, even though we're trained, don't allow ourselves to admit when we're having difficulties. And in some way, by your being so open and honest about what you're going through, perhaps as a threat to others, because they too are too afraid to share what they are going through. And, for this podcast, Laverne and I were talking about sharing our experiences. We too have had adversities in our lives, and I've seen a psychologist in the past. Also, when I'm undergoing training in psychiatry at the time, quite anxious about my finals, and I was, involved in some self-sabotaging behavior, not sitting and really coming to terms with the work. And so, there'd been some personal things that I needed to work through, but just sharing that is very difficult for us, because we're supposed to not be frail, whether we're talking about mental illness or even physical health, which we neglect and deny, and believe that we're supposed to just soldier on. And unfortunately, we see the results in, very high suicide rates in our profession, burnout and divorce rates. So we are not a healthy population group, as we'd like to believe.
Unfortunately not. And I see it now, especially working within the public sector, how many of us are burnt out, how many of us are depressed, how many of us are anxious, where people don't want to go and see someone to assist them. They'd rather either self-medicate or have someone from work prescribe them something to assist them, where mental health in doctors still has such a stigma that we are too afraid to admit that, listen, sometimes I do need a little help.
Absolutely.
Yes, Chanel, I want to also share with you that Shadi and I, we were involved in a organization that was breaking down stigma before You Are Empowered came to the table. And we went to final year medical students and we would talk to them about their thoughts of mental health and stigma. And we were shocked to hear how people would say, as you mentioned earlier, the derogatory words would be something that they would easily use for patients. And then we would bring it closer and ask them, would you employ somebody with a mental health condition? And the thoughts would be, no, I would not. And what if your colleague had a mental health condition? Would that be something you would consider? And we were actually very, very shocked at what happened with our kind, mental health medical students rather, that was already stigmatizing people with mental health, and we were worried about what was going to happen with them as doctors. So I can understand your challenges there.
Yeah. What I'm very grateful for is the fact that the Healthcare Practitioners Council of South Africa, in their new June 2025 guidelines, they've actually updated and added a booklet on how to prevent burnout and how to approach mental health disease in healthcare practitioners, which I think is really a step in the right direction to, one, destigmatize mental health, because now it's recognized by the Healthcare Practitioners Council of South Africa, and also to enable and educate other people in the profession on how to deal with colleagues, how to not use derogatory terms, and how to accommodate their colleagues that need this assistance.
Oh, absolutely. That's wonderful to hear that there is some progress there.
So, Laverne, have you ever had that experience having to seek help at any stage of your career?
I have seen a psychologist after my divorce. I was going through a tough time, and then reached out to be a colleague to ask who would they recommend, and saw a psychologist. And probably one of the best things I did for myself at the time. Really, such a meaningful experience to be introspective, because I think it's something we don't do necessarily. We are so busy looking after other people, and as we've said, not necessarily after ourselves. So something I can highly recommend to people to be in therapy. It's really meaningful.
Yeah. I was wondering also, in terms of support and family, what kind of support you received. Because sometimes the stigma has a sneaky way of sticking onto the family too. We call it proxy stigma. And even as psychiatrists, we experience it, oh, why did you choose psychiatry? I'd say to them, as opposed to what? Cardiology? That's just a muscle. Sorry, no offense, cardiologists. What was your experience?
With regards to support, from the beginning, both my parents were very, very supportive. My mom especially. We are very different people. I'm very emotional. She's very logical. So initially, she didn't really know what to do with me. She didn't know how to support me. But the growth that my mom has shown shows me also how strong she is and how resilient she is, because she has done neuro coaching courses, she's done personal coaching courses to assist me, to assist other people. And her view on mental health, since I've started up until now, has changed dramatically to such an extent that she is also helping others, she's helping me. And the support that I've received from her, as well as the rest of my family, has been incredible. It's also very nice to have colleagues who are supportive. I have 3 friends from my current working environment who are incredibly supportive, who are always there to listen. When I went through a recent breakup, one of my colleagues even sent me a care package when I was feeling anxious and depressed. And also my church group. My one best friend also has been helping me, has been there for me. If I am anxious during the night, she's been there. So I'm just so grateful to have a great support structure, not only in terms of friends and family, but also in terms of colleagues.
Yeah.
I want to ask, you mentioned that you had a suicide attempt. Would you mind sharing that with us?
It was in my last rotation of final year. I was in internal medicine, which I'm not going to lie to anyone, is my least favorite rotation in the whole wide world. And I was alone in my group. I didn't have my usual support structure. And it was just very confusing. I was very alone. It was very hardcore and everything, because we have 12 systems that need to be studied during this time. So I felt like everything was just collapsing in on me, this whole workload, everything that needed to happen. And I was already not in a very good space at that point, because I needed to write 2 sets of exams in 1 week, which felt impossible. And the one night I just felt like I'm done. I would rather not be here anymore than to have to deal with this. And I ended up taking all of my gabapentin meds. But as soon as they went down my throat, I was like, no, this is not the way to end it. This is not the way your story is going to end. And I then vomited them. And the next day I sought psychiatric help, because I decided that this was not going to be the end of my story. I'm not going to cut it off prematurely and decide that this was it. It was a very difficult situation, because I never thought in my life that I would hit such a low point where I didn't see anything except darkness. So that was when I then came to see you the next day, and you then helped me with my rehabilitation process. at the psychiatric facility, where I then got all the help that I needed for the next few days to help get me back on course. And then eventually, everything didn't seem so dark. It was a bit of a letdown that I then still needed to continue with my studies while other people were starting their internship. But looking back on it, I'm grateful for it, because it got me to a point where I was back in the driver's seat instead of being not in control of my own vehicle. So very grateful for the experience. Definitely wouldn't attempt it again. But yeah, very grateful for the experience and for what I learned from it.
And in your sharing your story, you know, along this timeline, it sounds to me as though from the age of 18 then till about your final year, you managed to get through medical school whilst being ill. You know, even though you did seek help at some different stages, but that's commendable, you know, already in and of itself. And so I want you to be able to appreciate that. And I wondered, you know, other than drawing on family and friends and seeing a psychiatrist, were there other modalities of treatments that you engaged in? You mentioned a therapist as well. Other ways that you found to help yourself in the healing journey?
So yes, physical activity is still quite important to me. I have joined the gym, and I try to at least go twice a week. Then also my church group has been incredibly supportive. Religious activities have really helped me to keep myself grounded and to keep myself within a situation where I've got a set schedule for every week. I need to go to cell, I need to go to church, which also helps me to not stay in a rut if I'm in one. And then also my creative side, which I take a lot of emotional strain out on a canvas with a piece of paper, with pencils, with whatever I can use to create. And I think that's something a lot of people often forget, is that when we have emotional turmoil, we need to use that emotional turmoil to create something else. And it sounds strange, but even in my work, it's very important to me to, when I go, to also remove myself, to remove that emotional turmoil from my situation, which then also ends up helping, because you see that what you are dealing with sometimes is relatively small in comparison to some of the problems that other people deal with. And that care and compassion that you then show to other people, you then see that you need to give it to yourself as well.
Yeah. Self-care.
Definitely.
Self-compassion.
Big fan of a nice relaxing bath at the end of the day.
We all love those. Chanel, is there, in your current experience as an intern, has your journey though influenced your experience with patients? You mentioned being more compassionate, but has it influenced your experience to potentially recognize mental health illness in a different way, and also in other colleagues that you could guide and aid them?
It definitely has. I am a very big advocate for patient care, and especially mental health care within a primary healthcare setting, where a lot of patients, when they come to you, they're like, "Doc, I'm not sleeping. I'm crying all the time. I'm sitting with this, I'm sitting with that." And then they also within their communities face stigma around it, where if you are someone who has had mental health care issues before, where you have walked the road, I feel it puts you at an advantage, because you know what to ask, you know how to help them, you know what resources they might need, and you also connect with them on a personal level. I know it's not always appropriate, but sometimes when a patient comes to me and they tell me that, "Listen, on citalopram I'm having this," or "on fluoxetine I'm having this," I'm like, "Okay, let's try you on a different med. I have been on this before personally. I did not experience XYZ as a side effect. And then they immediately start softening up because they're like, oh, so you also have something. You are also struggling with mental health, even though you're a doctor. So I think that as we are more open with ourselves and also a little bit more open with our patients about our experiences as well, I think advocacy for mental health and helping your patients with their mental health situations, it goes a little to a lot further.
I hear it makes you human. Hey,
It
makes you
definitely
human,
does.
and absolutely we are human. And I think people relate to that humanness in us. That's why they actually come to you, because they find something that they can relate in you. So meaningful that you do that.
And the other aspect of the question that Laverne asked, I'm curious, some of the difficulties that I observed in medical school is, that lack of empathy of the institution and how change was very slow. Is there an opportunity in this aspect in your work to also challenge that status quo? Or maybe it's unfair to put it on you, but you're saying the Health Professionals Council has made it easier to recognize burnout. And I think that a lot of that work has been around COVID, where we started having more open and honest conversations around mental health. But have systems shifted in the workplace? We spoke about medical school. Have things shifted in the workplace in terms of accommodating staff?
That is quite a difficult question to answer, because in my experience, it really depends on the department. I have had departments that have been wonderfully accommodating, where if I told them, listen, I have a psychology appointment this afternoon, they were like, okay, cool. You can leave an hour before so you can go and have your session. We don't expect you to come back this afternoon. If I tell them I have a psychiatry appointment, okay, cool. Bring us a sick letter in the morning. We don't mind. And also if I told them, listen, I'm having a really bad day, they would allocate me to certain areas where my patient interaction wouldn't necessarily be to such an extent that it would drain me. Those have been some of the good departments. But then in other departments where it's all about numbers, it's all about what you do, how much you do, and how many patients you can see in a day, it's about pushing the line. That compassion, that care for colleagues and for juniors in the department is just not there. They literally, I once had an experience whereby a senior told me that, no, you cannot go to your psychology appointment this afternoon because you still have this, this, and this to do. Yeah. Which unfortunately to me is quite sad. And even after I told them about an experience that I had earlier in the year, they told me that, listen, your ECT, it's something I need to worry about. Is the fact that you had ECT, do I now need to worry about you remembering things or remembering how to do your job? Which I unfortunately found incredibly stigmatizing, because I am honest with you about the treatment I have had. I'm honest with you about my experiences and my needs. How are you now asking me these questions? And also, unfortunately, even Dr. Mountney got involved in the situation, the relevant department still had me on 8 calls the following month, 8 calls that lasted more than 24 hours, where they literally just didn't care. So different departments have different views on mental health, and I feel that, or I hope that, these new guidelines from the HPCSA really push us towards better looking after not only the juniors, but also towards our registrars, our consultants, and even our heads of department, where we can say that, listen, we need help. We need someone to educate us on burnout and mental health within medical the medical profession and how we can approach it better so we can all take care of ourselves.
Absolutely. And, you know, in this moment, I'm reminded of a young man who passed away in KZN, and that wasn't a mental health diagnosis. So in general, we need to do better taking care of junior doctors and ourselves.
Definitely.
It's clear that we still have a long way to go, and this is why we do things like we're doing, and thank you for being brave to share your story. I want to ask a little bit, and I think it's a treatment modality that is extremely stigmatized, and you've had ECT. Would you mind sharing with us about your experience of that?
My first ECT treatment was at the end of my 6th year, where I had heard about ECT in my psychiatry rotation. I had heard what can help and how it can go wrong. So I was initially quite reluctant because in the DSM it says, oh, it's for treatment-resistant depression. So I was initially quite scared, but my experience with ECT and how it has helped me to be better and to feel better is quite amazing. Yes, afterwards you feel a little bit groggy, your head hurts, your jaw hurts, but every experience that I've had with ECT thus far has been quite good. And I have even gone periods where I think I went 18 months without needing a second course of ECT. And I think people shouldn't look down on it as a treatment modality, because sometimes the meds alone don't just work. You need like a little factory reset, which is what I like to call ECT, because I genuinely always feel better afterwards.
Yeah, unfortunately, one flew over the cuckoo's nest. It made a big
Lasting impression.
Yeah, impression in terms of electroconvulsive therapy, and I think people still have that in mind. So meaningful that we modernize the thinking around that and understand the value it actually has in treating depression.
Definitely.
In fact, tying into that is the work that we used to do as Psychiatry Empowered now, as you are empowered, was really looking at how film and, I mean, the other media as well, portray mental illness in a way that continues to stigmatize, the experiences of the patients, our treatment modalities. And in fact, there's still a view that, if you're doing psychiatry, as I said, why not cardiology? It's almost dismissed as a part of the big five in medicine. And we constantly need to be fighting our space in the profession. And what we also see, and I don't know if you've seen this, is when our patients present, I'm talking about those that have mental health care diagnosis at a general hospital, if our colleagues know that, they immediately send them to the psychiatry department without doing a general examination, and they might not be presenting for that. So our patients suffer from poorer health outcomes from general medical causes because they're neglected in the system.
Chanel, if there's a colleague out there that's watching us and that's in your position, what would you like to tell them?
Take care of yourself first. No one else is going to take care of you. No one else is going to care as much about you as you do. Have support, get help. There is no prize for seeing the most patients, for doing the most work, for doing the most overtime, and for being the strongest medical practitioner out there. If you feel that you need help, that you need someone to talk to, that you are having intrusive thoughts, that you are not sleeping at night, go and see someone. You expect patients to come and see you if they've got a problem. So why can't we do the same?
Absolutely.
Yeah.
When we invited you for this interview, we asked you what your favorite dish was. And you had said pasta. So part of the experience in our kitchen is that we cook that favorite dish for our guest, but we make a vegan version of that. And in the essence of change starts here, change is also starting here from a plant-based point of view. So you are going to share with us now a spaghetti bolognese, but a plant-based version.
Ooh, yummy.
Well, the meal is ready. I hope you guys enjoy it. As a token of our appreciation, we'd like to gift you lunch with a dragonfly. We hope you enjoy it. Thank you again for being brave and kind to share your story with us in our kitchen.
Thank you very much for having me, and thank you very much for giving me this platform to talk about my story and for advocating for mental health.
It's been a privilege to have you. Thank you.
Let's tuck in.
Yes. Can't wait.
This podcast was made possible with the assistance of Zydus Healthcare.